Today we will present to you guys about infertility. This is our theme. Introduction to infertility. Infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility in Malaysia. Infertility and declining fertility rates are significant concerns in Malaysia. The country's total fertility rate, or TFR, has been on a downward trend since 2013, falling below the replacement level of 2.1 children per woman. In 2023, the TFR slightly increased to 1.7 from 1.6 in 2022. But it remains below the replacement level. Several factors contribute to this decline, including infertility issues. The government has implemented various initiatives to address these challenges, such as offering affordable fertility treatments, establishing men's wellness clinics, and providing financial incentives like tax exemptions and EPF withdrawals for fertility treatments. Based on the graph shown, Malaysia fertility rate for 2025 is 1.90, a 0.73% decline from 2024. Malaysia fertility rate for 2024 was 1.91, a 0.73% decline from 2023. Malaysia fertility rate for 2023 was 1.92, a 0.88% decline from 2022. Malaysia fertility rate for 2022 was 1.94, a 0.87% decline from 2021. Total fertility rate represents the number of children that would be born to a woman if she were to live to the end of her childbearing years and bear children in accordance with age-specific fertility rates of the specific year. What are the types of infertility? First, primary infertility. You've never been pregnant and can conceive after 1 year or 6 months if you are 35 or older of regular unprotected sexual intercourse. Secondly, secondary infertility. You can get pregnant again after having at least one successful pregnancy. Third, unexplained infertility. Fertility testing hasn't found a reason that a woman or couple is unable to get pregnant. Factors of infertility. First, eating disorders or anorexia nervosa and bulimia. Secondly, diminished ovarian reserve or DOR. Third, polycystic ovary syndrome or PCOS. And lastly, excessive alcohol consumption.
To choose is in vitro fertilization, or we call it IVF. IVF is a medical procedure whereby an egg is fertilized by sperm in a test tube or elsewhere outside the body. Menstrual cycle. It allows healthcare provider to control treatment and maximize the number of mature eggs during the egg retrieval procedure. Second, egg retrieval. The mature eggs are retrieved from the ovaries under anesthesia, usually via a thin needle insert into the vagina. The retrieved eggs are then placed in a lab dish with the sperm. Third, fertilization. The sperm are mixed with the egg in the lab dish, allowing them to fertilize. If there are issues with sperm quality or quantity, a procedure called intracytoplasmic sperm injection (ICSI) may be used, where a single sperm is injected directly into the egg. Fourth, embryo development. The fertilized egg embryos are placed in an incubator for 2 to 6 days, allowing them to develop. During this time, the embryos are monitored and the most promising embryos are selected for transfer. Fifth is embryo transfer. The chosen embryo are transferred into the woman's uterus using this catheter. The embryo is placed in the uterus, where it can implant and develop into a pregnancy. Last but not least is pregnancy test. Approximately 2 weeks after the embryo transfer, a pregnancy test is performed to determine if the transfer was successful.
Next, as we can see, this is all the diagrams that relate to in vitro fertilization.
step is taking fertility medications in the form of shots to help your ovaries produce several mature eggs. The goal is to make 10 to 15 eggs. It takes about 2 weeks until your eggs are ready for retrieval. The retrieval process is a 15 to 30-minute procedure. The doctor uses an ultrasound to put a thin, hollow tube through your vagina and into the ovary that holds your eggs. The needle is connected to a suction device that gently pulls the eggs out of each follicle. Now comes the part everyone's most familiar with: combining sperm with your best eggs. In IVF, the egg and many sperm are left in a laboratory dish to fertilize on their own. The fertilized egg then divides its cells until it reaches the blastocyst stage 5 to 6 days after fertilization. Multiple embryos are then transferred back into your uterus in the hopes that at least one will implant itself and begin to develop. To find out how your baby grows and develops each month, please watch my next video.
For the fatwa regarding the IVF treatment, first, Islamic Fiqh Council Majma' al-Fiqh al-Islami, artificial insemination is permissible if the sperm is from the husband, the egg is from the wife, and fertilization takes place in the wife's womb. Any use of a third party, sperm, egg donor or surrogate is haram, which is forbidden. For the second one is from Al-Azhar Fatwa Council by Egypt. Al-Azhar, a leading Islamic institution, has also permitted IVF under similar rules. It is lawful to resort to artificial insemination if it is between husband and wife, and the fertilized ovum is implanted in the uterus of the wife during the marriage.
So, in conclusion, IVF offers a promising solution for couples struggling with infertility in Malaysia. While the journey may be emotionally and financially challenging, the advancement of medical technology has significantly improved the chance of conception. With proper guidance from fertility experts and strong emotional support, IVF can help many couples achieve their dreams of having a child and building a family. This is our references for Task 1.
Thank you for your attention.